A local doctor is helping patients who qualify for medical marijuana. Dr. Mark Wood says it's often a hurdle for patients to find physicians who will certify their conditions to register for the prescription in Illinois. Patients come to his office in Fulton from places like Rockford, Peoria, Cedar Rapids, and Waterloo. Local 4 Sean Logging joins us live in the newsroom with how he changed his mind toward the drug. Sean?
Yes, Jim. Based in Fulton, Starflower Clinic and Wellness is the only clinic in Northwest Illinois welcoming all patients to provide the medical examinations Iowa and Illinois require for the medical cannabis card. Illinois has more than 40 qualifying conditions, and in Iowa, it's about 10.
My name is Renee, and I'm calling with Starflower Clinic. When I used it myself, I realized that it helped not only manage my pain, it helped me sleep, and it also brought me in a good mood.
It was a week in Colorado. Renee Appleby says she didn't just learn, but felt the benefits of medical cannabis to address her conditions like chronic pain. As cannabis consultant and office manager at Starflower Clinic and Wellness, her experience is one she shares with patients searching for relief.
Went through every other treatment and all the other options, and seeing that actually something finally works for them is remarkable.
Renee helps to guide those seeking treatment when they come to see Dr. Mark Woods.
On average, upwards of 12 to 15 patients a day.
Dr. Woods has been working 1 or 2 days a week at Starflower since October, while still managing a family practice.
Doesn't work for everybody, but in those patients that it does work for, it can work very well.
But Dr. Woods says he wasn't always a believer in this treatment until seeing the results after legalization.
Several states that have allowed medical cannabis, and now there's 11 states that allow recreational cannabis. So it's an evolution of my thinking.
But Dr. Woods adds he knows there are also many physicians hesitant about this still relatively new move. Dr. Woods says part of it might be education about cannabis or the providers they work for.
We have many physicians who cannot certify their own patients for medical cannabis, but refer patients to us for that very option.
For Dr. Woods and Renee, the primary goal is for patients to feel well.
Able to get their life back and do normal activities, and a lot of us take that for granted, but a lot of people just want to feel well again.
Both Dr. Woods and Renee say they support Illinois' move to legalize recreational cannabis, especially for patients who might not have a qualifying condition. There's also a bill on Illinois Governor J.B. Pritzker's desk that would make the medical cannabis pilot program permanent. It's actually set to expire next year. Plus, it adds 11 more qualifying conditions, including chronic pain and autism. In the newsroom, Sean Logging, Local 4 News.
Sean, thank you.